Hey, it's Dr. Mom, Dr. Chantal Bonvinson Kungu, and today I'm here to talk herbs with you. Today's herb is rosemary. It's one of my favorites, and I'm so excited to share with you today. Now, first, I want to preface this video by letting you know, as always, I am a physician. However, I may not be your physician, and so anything that I share is meant to educate or maybe in adjunct to what you already know about rosemary, maybe expand your armamentarium a little bit, but not meant to replace anything that your doctor has instructed you or your physician has advised you against. This is not meant to replace that. Please, please, please follow your physician's advice. However, it may be used as a springboard to discuss new issues with your physician. You know, growing up, culinary education was not a big part of my household instruction. And so I was so excited when I came to have a mother-in-law, and my mother-in-law is from Uganda, and she's a wonderful cook. She's a botanist. She knows a lot about plants and herbs, and really when she cooks, she uses a lot of herbs and spices to enhance the flavor of her foods. And so this is how I was introduced to rosemary. And of course, although we spend a lot of time in the kitchen, I have a lot more to learn. I will be very transparent about that when it comes to cooking. But as always, I wanted to know if there were any health benefits of this very beautiful and aromatic plant. And to my delight, I found that there are some. Now, rosemary is an evergreen plant, and it is part of the mint family. It's extremely resilient. It can grow in the most excruciating of environments, and so you plant a little bit of it, it will consume your yard or your garden in no time, which is nice, right? Very easy to grow, and that means free for some of the uses that I'm going to discuss. Now, rosemary can be used topically, so on the skin. Rosemary can be ingested, obviously, because it is edible. It also can be inhaled. So a lot of the essential oils now have rosemary in addition to the citronella and the frankincense and the mint, etc., eucalyptus. Now, rosemary. And rosemary, when inhaled, has been shown to improve cognition and concentration, improve memory. It also is energizing. There have been a couple of small studies to show that when students inhaled rosemary extract, their performance was better on testing. Studies have shown that rosemary is helpful for Alzheimer's type dementia as it improves cognition. Also, it is a stress reliever, and it reduces certain stress hormones in the body when inhaled because it gets absorbed into the bloodstream. So when it comes to topical uses, have you guys ever heard of Rogaine? Yes, I assume so. Rogaine, also known as minoxidil, is used for a treatment in male pattern balding, also known as androgenic alopecia. There was a study, albeit small, which compared the effects of minoxidil and rosemary extract. And so at 3 months, there wasn't really a big improvement in hair growth when the two were compared. However, at 6 months, there was substantial hair growth in both groups. Why is this important? Well, because rosemary showed that it was just as effective. And what the men did was they rubbed in a little bit of oil for a few minutes every day, and after 6 months, they had improved hair growth. I think that's pretty cool. Also, there are other types of hair loss, right? There's something called alopecia areata. Some may say areata. Rosemary extract has been shown to help with that. Now, one thing that rosemary does is it interrupts testosterone from breaking down into its different components. One of the components that testosterone breaks down into attacks hair follicles. Well, rosemary intercepts that process, and for that reason the hair follicles can be healthy. Also, when applied topically, because rosemary has vasodilatory properties, meaning the blood vessels, it helps the blood vessels expand, can be used to increase circulation, which is great. I will share something with you. Much of my day is spent on my feet, chasing after nurses, families, patients, etc. And I often come home with certain aches and pains, so back pain, knee pain, etc. Well, guess what? Rosemary has anti-inflammatory pain reliever properties. And I can assure you that I have recently made my own rosemary extract oil and have applied it when I've come home with my little aches and pains, and it has worked each and every time that I've applied it to my skin. Within hours, the pain is gone. I love it. I mean, it's great. Again, free, easy to grow, easy to make. Additionally, when applied to the skin, now this may be actually one of my favorites. Why? I now reside in the southern part of the United States. I love it here. I love the South, no regrets. I am an LA girl. Los Angeles will always be in my heart. But I am happy in the South. Although, what happens in the summertime? It gets humid, it gets sticky, and there are bugs everywhere. And the bugs go crazy. They attack you like they are nuts. And what that can do, right, is spread these very nasty diseases around. Because mosquitoes carry things like Zika virus, which has been all over the media in recent times, and so you've probably heard of it. In the northeast United States, there's something called Lyme disease, which is carried by ticks, and so you get a tick that's stuck on you, it sucks your blood, it also contaminates you and can lead to very devastating illness or disease called Lyme disease. And rosemary extract has insect repellent properties. So you better believe this summer myself and my kids will be bathed in rosemary extract oil. I'm super excited about that because I mean, that's a big deal, right? In preventing possible serious illnesses. For the German Commission E, which is like a botanical governing body, it has on its formulary as a regular treatment for indigestion, rosemary extract tea. Why? Because it helps with indigestion. When ingested orally or taken by mouth, also it can help to increase bile. Bile is essential in breaking down fats in the body, and so it improves digestion. Rosemary can also help with blood sugar regulation. So for people who have diseases such as diabetes, may be helpful with blood sugar regulation. Also, although most of the studies have been performed in mice and not humans to date, it has shown to reduce the levels of leukemia and breast cancer cells. And so hopefully with time we'll know more about its effects in treating cancer. Also, it has antibiotic properties. Therefore, it can help fight infections, but also it's been shown to work synergistically or in partnership with antibiotics when someone is already on one and help improve the effectiveness of the antibiotic. So that also is wonderful because one of the biggest threats right now to health are drug-resistant organisms. And rosemary is an herb, a very effective one. So that means that it does induce biochemical reactions within your body. And so if you have epilepsy or are pregnant or have hypertension, you want to be careful not to take rosemary supplements and always speak to your physician. So rosemary can interact with anticoagulant medicines such as Plavix, aspirin, etc., Coumadin, and so be careful with overloading the rosemary if you're on any of those medicines. The biggest thing is communicating with physicians about what it is that you're taking, right? Because sometimes we downplay herbs because we think, they're not as potent as maybe some of the prescribed medications, but the truth is they are potent. Please go to my website. It's drmom.com. It consists of a survey. I'm trying to gather your thoughts and experiences so that I can help in partnership with you to make medicine better. And so please fill out the survey. It's very quick, 2 questions. And I hope you enjoyed the video today. More to come. Have a great day. Goodbye.